I'm going to explain to you the differences between BBL, BBL HERO, MOXI, and HALO. So BBL has been around for 20 plus years. It stands for broadband light, and BBL is a type of IPL. So if IPL were cars, BBL is the Ferrari of the light and laser world. So again, BBL Forever Young is a treatment that we've been doing forever, and it treats brown spots, it treats redness, it helps with pores, it helps with texture, it makes you make collagen, so it does lots of wonderful things. It is the only IPL out there that has done a study where they did a study at Stanford, and they took people that were over 50, they treated them once a month for 3 months. Then they biopsied the area they treated, they biopsied an untreated area, and they biopsied some college kids' skin. And they found that the molecular genetics of the skin cells were similar to the college-age kids, just after 3 BBLs. So that is fantastic. They also did another study, well, they've done lots of studies, but they did another study that I like to quote, and that is where they took providers and they said, hey, providers, how old do you think those people look over there? And we said, well, they look about 45, 46 years old. You're right, you can tell age. Great. How about those people over there? And we said, oh, they look about 45, 46 years old. Well, they were not. They were 55 to 60 years old, but they had been doing routine BBLs. So that is amazing. So not only objectively is your skin better, but subjectively you look younger. And who doesn't want to look younger? So that's BBL. And then recently, 2020 came along, BBL HERO. And that is 4 times the amount of light, and it uses twice the amount of cooling. So it is a fantastic advancement of the BBL. So we can convert the studies of BBL to BBL HERO, but now you're getting 4 times the treatment every time you do a BBL. Or a BBL HERO. So that means we can do BBL HERO arms in about 10 minutes, whereas before it would take us an hour. So we can get rid of pigmentation and help with the health of the skin in just a quarter of the amount of time. So BBL HERO is faster with more light, and it's the same type of treatment in terms of getting rid of browns and reds, but you're just going to do it more effectively and quicker. It is still superficial, somewhat superficial treatment in that in the whole spectrum of light, we're using the visible wavelengths. So again, we're treating pigment, we're treating redness, and there's no downtime. So that is a great thing to know about BBL, 0 downtime. Now, MOXI is a laser. So here on this pretty little machine, and this uses a 1727 wavelength laser. So now we're going into the infrared section of the spectrum of light. So what MOXI does is it helps with pigmentation as well. It's great for healthy skin, so young people can do it, older people can do it. It is non-ablative, but it gives you a deeper treatment than BBL. There is a little tiny bit of downtime where your skin feels like sandpaper, and it is non-ablative, because that's what we're going to talk about with HALO in just a second. It's not going to help with the wrinkles as much, but it just helps to refresh your skin. So BBL and MOXI together, amazing for pigmentation. MOXI is great for melasma especially, and if you're doing treatments, because melasma is only something that is very difficult to treat, we can control it by doing MOXI every 3 to 4 months. So if BBL is a little bit more superficial, MOXI is a little bit deeper and is now a laser treatment, and now we have HALO. And HALO is an ablative procedure. So it's an ablative laser. It uses 2 different wavelengths. The first wavelength is treating the pigment, the second wavelength is doing the ablation. So what does that mean that it ablates? It actually makes channels into your skin. So from that channel, your pigmentation can come up and out, so it's a highway out of your skin, and now you're left with a channel in your skin, which will have to tighten. So HALO is great for deeper pigment and to help with wrinkles and tightening and lifting. So BBL is a little bit more superficial, MOXI gets a little deeper, and HALO gets the deepest, and it is a refresher. So if you want to start by jumping off the high end or the high dive of the pool, start with HALO and jump off the high dive, refresh your skin. And then if you're like, well, I want to kind of be on that low dive, then do MOXIs throughout the year. And if you want to just kind of jump in from the edge of the pool, then you do BBL. Everybody can use all of these treatments. Personally, for me, I like to do 4 BBLs a year and my HALO a year. But now that we have MOXI, it's going to be 4 BBLs followed exactly at the same time with MOXI, and then my HALO once a year. So that's a great regimen, depending on your skin type, of course, and what your treatment goals are. So BBL, no downtime, more superficial, treats reds and browns, makes you have healthy skin, resets your DNA. MOXI is going to treat more melasma, especially great for younger patients, but it treats pigmentation using a laser, really minimal downtime, and HALO is going to get even deeper, and that's going to be pigmentation and ablation. HALO does get deeper than the rest, but there is the downtime with it. Oh, both the MOXI as well as the HALO will treat early skin cancers as well. So win, win, win. But the most important thing to know about all of them is you can't go wrong by picking one. This is kind of like going to the gym. You're going to go do your weights one day, you're going to swim one day, you're going to run one day. I can't tell you what's going to be the best for you, but I can tell you all of those things are going to better your body. Same thing with BBL, MOXI, and HALO. They're all going to better your skin. So when we do things in combination, it's going to make your skin hit a home run as opposed to just getting to first base or second base or third base. We're going to go with a home run by doing the combination of all of them. So if you want to find out more or you have more questions, you can find us online at RejuvenationMD.com.